Thank you for watching the Miller Chiropractic Minute. We have an addendum this week because we've had a lot of interest in the headache talk that we had, and a lot of questions stem around the neck and how to pick a doctor that needs to be picked for treating. So, um, one in specific asked if we should be picking a sports med doctor or they should see the regular GP or a chiropractor. And there are a couple of questions about that need to be addressed. A, if you have headaches, if you go to a chiropractor, several things to watch are: A, does the chiropractor take X-rays? Does he look at orthopedics and neurologics? Does he talk to you about if you're not doing well in the first 3 or 4 adjustments, maybe getting an MRI, making sure there's nothing organic wrong with the brain, meaning maybe making sure that there's no tumor or something of that nature? That's more important. If you choose a medical doctor, they're going to start out treating you right away with most likely smooth muscle relaxants, painkillers, analgesics, that type of thing. My approach for most people is, when they see me for headaches, is we say within a week we should see the headache starting to alleviate and go away. If you don't have that type of immediate reaction, we need to look at going into a deeper study and doing an MRI on the brain or a CAT scan, making sure there's not something there. We also need to make sure we do a thorough evaluation of the history. What brings on the headaches? How often you have the headaches? What's the intensity? What's happening in those situations? Because they all give you keys. If you have headaches in the morning but not in the afternoon, if you have headaches with stressful situations, what are the things that trigger a headache for you? Now, when we talk about what type of doctor to look at, if you have biomechanical problems, then definitely you need to be seeing at least a chiropractor and then a physical therapist. A sports medicine doctor is the same as a medical doctor. They will probably be more apt to send you to a physical therapist, but physical therapy generally addresses soft tissue. So if you do not get in there and address not only soft tissue but the structure, the substructure, the spine with which all the muscles hang off of, then the headaches will most likely come back. It's better to do a two-tiered approach with hitting the soft tissue and hitting the muscle or the spine at the same time, and therefore you like your range of motion, you feel better, all those things are doing wonderful for you. That's why at our clinic we do physical therapy. We have a massage therapist on staff. We try to hit it in every way that we can because I'm not allowed to prescribe medicine. But medicine, you have to remember, modulates, it inhibits. That's what it does. It inhibits pain, and thereby you don't feel the pain, but you maybe haven't fixed what is wrong with the substructure. So in essence, you are creating an issue where, even though instead of being straight up and down like this, maybe it's twisted or kinked, and you have a problem there where the biomechanics are wrong and you need to hurt because you need to get that taken care of. If you take an inhibitor, then what happens is you cover this up and it's still allowed to go, and you will continue to degenerate it at an accelerated pace. Um, the other thing I tell people to watch is if you are an athlete, if you're training to be an athlete. I know there are a lot of athletes that watch this. Anytime you take ibuprofen, acetaminophen, anything like that, you inhibit function in the body. And it is very important to know that anytime you inhibit function, you create acid. Anytime you create acid, you have the potential to raise your chances of incidence of injury. So, when picking a doctor, A, talk to a chiropractor and see if he works well with medical physicians. Maybe you do need to go on a short-term anti-inflammatory. Next is get some x-rays, do a range of motion study, see how you are being affected physically, functionally, and then go to restore the function. Last but not least, look for somebody who maybe does functional medicine. Functional medicine looks at the processes in the body to help restore optimal health. And there are tons of functional medicine practitioners, chiropractors, medical doctors, herbalists, that type of thing. I hope this answered your question. Once again, if you have a direct question, don't hesitate to email me at indianabackdoc@comcast.net, or I am Indiana Backdoc on Twitter. Thank you very much and have a great day.